You are listening to Pharmacy IT and Me, your informatics pharmacist podcast. It is Monday, May 6, 2019, and welcome to another episode of Last Week in Healthcare IT. So last week on Friday, we actually didn't do an episode of Last Week in Health IT, so I thought we'd do that today. And we'll be talking about a few things that happened in the news. So actually, last week didn't really have a lot of news happen. So today's episode is probably going to be a really short one. I actually only have 4 headlines that I thought were probably important to mention. But other than that, there shouldn't be that much to discuss. So let's just get right into it. Alright, so the first headline is Imprivata unveils identity management tool that works with Microsoft Cloud apps. So if you don't already know, Imprivata is a company that they're basically focused on secure sign-ins. And, we used Imprivata at my last workplace to do single sign-on and badging in, right? So instead of a provider or a healthcare worker needing to log in by typing in their information, they would just need to scan their badge to sign on to the system through one single sign-on, and it allows them to efficiently do their workflow. So Imprivata, the company, they revealed that they have new identity management tools that now actually work with Microsoft Cloud apps. So it's not only just Microsoft desktop apps, which are, the older versions of Office, but now even Outlook 365 or Microsoft Cloud Office or things like that, they're all going to be working now. So I think this is really important because a lot of companies are moving towards the Office 365 model. And with that improves workflow because of the cloud model, and having Imprivata work with Microsoft applications that are on the cloud, it just makes that entire workflow a lot more efficient for the healthcare worker. All right, so the next news item I have is Blue Cross Blue Shield HealthBox Kickoff Data Innovation Challenge. So this is basically a contest that the Blue Cross and Blue Shield associations and HealthBox that is focused on creating applications or solutions that increase the ability to provide care or access to care, and pushes for patient engagement, and also improves the delivery of healthcare and outcomes. And in this competition, there are actually 3 categories. So one of them is to somehow reduce barriers to care. And then another one is to enhance a participant or member's journey through the healthcare system. And then the other one is identify, predict, and prioritize members and providers for real-time interventions. So I think this is a really good program to kind of put a motivating force behind all these companies to push for better ways of providing care through the use of technology. And what they say about the winner for this is that they'll be granted 6 months access to a subset of the database that the Blue Health Intelligence has, so that they can use that data and leverage that data for potentially showing models that can improve outcomes or patient engagement. If you are interested in being a participant or submitting something to enter into this competition, you can always visit databox.healthbox.com/applicant/login. And I'll also be putting that in the show notes in case you're interested. Alright, so the next news item I have is the FDA to deploy AI to aid food regulation. So the food system is very complicated and convoluted, and the agency is saying that they're going to be leveraging the use of technologies in blockchain and the Internet of Things devices and technologies so that they can make that whole food system a lot safer and more efficient. And right now they're doing a pilot study in which they are using artificial intelligence and machine learning to assess the way that the foods are being imported into the country through the ports. And then they're trying to use that information so that they can improve that process so that the imported goods will meet the safety standards of the US. So I think this is a really good method of showing a proof of concept so that eventually the same technology can be pushed over to medications and, eventually help with the Drug Supply Chain Security Act, since there's already been talk about using blockchain as a technology to track all the medications that are required in the Drug Supply Chain Security Act. Alright, and the final news item I have is genetic testing is to drive personalized prescribing. So in this particular news article, they talk about Pinnacle Ventures, a company that's part of the Pinnacle Midlands Health Network, and how they are planning to do 5,000 pharmacogenetic tests over the next 12 months. I also interviewed a person on one of the previous episodes in which the person was Andrea Patterson, and she was from Genexus. And they are a pharmacogenetic company where the whole purpose is to use technologies to promote pharmacogenetic testing and then use that data to basically do precision and personalized prescribing for those who have certain genes that predispose them to specific conditions or specific severities of conditions. So similarly, Pinnacle Midlands Health Network, they're doing something very similar because they want to tailor a person's genetic makeup with prescriptions so that they can prescribe medications that work effectively for that patient depending on how that patient metabolizes the medication. So for them, this is going to be covering about maybe 65 to 70% of medications frequently prescribed in New Zealand. And they found that ethnicity is a very big component on how a person metabolizes drugs. Alright, so like I said, it's a very short episode, but before we go, if you'd like to hear more news on healthcare IT, you can check out great curated articles at healthcareitnews.com. It's actually where I go for daily healthcare IT news to keep myself updated on what's going on in that world. Alright, if you guys like this episode, you guys can subscribe, rate us on iTunes, Stitcher, Google Play, or any of your other favorite podcasting services. You can also follow us on social media on Twitter or Facebook at PharmacyITme or our Instagram at PharmacyInformatics. Or you can send me an email through tony@pharmacyitme.com. And I wanted to also plug a great networking opportunity through Pharmacist Connect. And to find out more, visit pharmacistconnect.com, which is PharmacistConnect.com. Thank you again for listening, and I'll see you on the next episode of Pharmacy IT and Me. And remember, technology is the tool, patient care is the goal.